So without further ado, let's go straight into the introductions. The COVID-19 pandemic has significantly impacted Malaysia's economy, highlighting the critical importance of sectors like technology and healthcare in driving recovery and future growth. The pandemic exposed existing skill gaps within Malaysia's workforce, particularly in technology and healthcare. In technology sector, there was an increased demand for digital solutions, yet a shortage of skilled professionals to implement them.
Let's move on to the first challenge, which is skill gap in technology sector.
The first one is post-COVID impact. The pandemic highlighted that the need for skilled workers in areas like artificial intelligence, data science, and software engineering. However, there is a shortage of experienced professionals in this field. This makes it difficult for companies to adopt advanced technology and compete globally. At the same time, employees don't have enough opportunity to improve their skill in this area, which widen their gap even further. The second one is mismatch between education and industry. Another issue is the disconnect between what taught in school and university and what employees need. Many educational programs haven't kept up with the latest advancement in technology. For example, students might not get enough practical training in fields like AI or data analysis. This means that graduates often lack the skill required for high-demand jobs. The third one is survey insight. According to a survey, 65% of workers in Malaysia believe that digital skills are essential for the current workforce. However, 68% of Malaysians say they don't have access to the tools and technology needed to develop these skills. This shows an urgent need for better resources and infrastructure to support skill building. The first strategy is industry collaboration through IDTAP. One of the key initiatives is the Industry-Driven Talent Acceleration Program, or IDTAP. This program connects to the government, educational institutions, and companies to work together. It ensures that training programs match what employee needs and focus on building skills through skilling and upskilling. For example, need to invest companies can provide skilling and upskilling program skill they're looking for. This program will help workers learn new skills and adapt to the change in technology. For example, workshop, online course, and mentorship program can give employees the tools they need to stay competitive. By making this initiative accessible to all, Malaysia can bridge the skill gap and meet the demand of the future. The third one is soft skill development. While technical skills are important, soft skills like problem solving, communication, and adaptability are just as critical. These skills help employees work better in teams and solve real-world challenges, especially in a fast-changing industry like technology. Employers and training programs need to emphasize skills to create a well-rounded workforce.
For the second challenge, relying on foreign expertise. Malaysia's lack of skilled people in the high-tech industry has resulted in a reliance on foreign expertise to fill essential positions. This dependence exists because local talent is frequently insufficiently skilled or experienced to satisfy the expectations of modern businesses such as artificial intelligence, data science, and software development. Relying on foreign expertise poses long-term sustainability challenges for Malaysia's economic and technological development. This dependence raises operational expenses for enterprise and may limit Malaysians' ability to build the skills required to drive innovation in the country. According to Dr. Apurva Sanghi, the World Bank's lead economist for Malaysia, poor macro-fiscal management and inadequate job creation for high-skilled workers threaten long-term progress. In 2023, 287,000 university graduates entered the workforce, but only 48,700 high-skilled jobs were available, highlighting a deep disparity between the supply of educated workers and the demand for skilled labor. The strategy is invest in technical and vocational education and training. Government investment in technical and vocational education and training (TVET) is important for addressing the skills gap in Malaysia's high-tech industries. TVET plays a pivotal role by equipping the labour force with the practical skills and competencies demanded by employers. Over time, the practice of TVET has become a key focus for policymakers seeking to develop a skilled workforce that meets industry demands, ensuring sustainable economic progress and fostering innovation in Malaysia's rapidly evolving technological landscape. The COVID-19 pandemic has greatly disrupted Malaysia's education system, emphasizing the need for investment in technical and vocational education and training. This investment would promote continuous education and reskilling, enabling individuals at different career stages to adapt to evolving job requirements. TVET not only equips individuals with practical skills but also has the potential to foster entrepreneurship and job creation. The pandemic underscored the importance of aligning TVET curricula with industry needs. For the third challenges, skill gap in healthcare sector. Malaysia's healthcare system confronts issues due to a lack of competent workers in critical sectors such as specialist nursing, medical research, and modern diagnostics since COVID-19. Many healthcare personnel do not have access to specialized training or opportunity to improve their abilities, limiting the sector's ability to fulfill the rising population's demands. As of 2021, Malaysia had 77,755 doctors, 18,575 pharmacists, and 115,230 nurses, resulting in a doctor-to-population ratio of 1 to 420 and a nurse-to-population ratio of 1 to 283. While these ratios are above the World Health Organization's recommendations, challenges persist in achieving optimal distribution and supply of healthcare workers across both private and public health facilities. Significant disparities exist in healthcare worker distribution between urban and rural areas, with rural regions facing more pronounced shortages. The strategies for this is to enhance specialized healthcare training programs. To address the challenges faced by Malaysia's healthcare system due to a lack of competent workers in critical sectors, especially in rural areas, government should enhance specialized healthcare training program. According to Lee Bee-Soon et al. 2022, many healthcare workers had little to no access to advanced training, which severely limited their ability to make good use of modern healthcare technologies such as telemedicine and AI-driven diagnostics. As healthcare systems increasingly adopt advanced technologies, specialized training becomes essential for improving patient care quality. For instance, during the pandemic, the Malaysian government has allocated 36.14 billion ringgit to the Ministry of Health, designating 31.5 billion ringgit for operating expenses and 4.64 billion ringgit for development expenses. Specialized training equips healthcare workers with the necessary skills to provide high-quality care.
Now let's talk about the final challenge Malaysia faced in building its human capital after COVID-19. This challenge is economic inequality, which hurts Malaysia's economy in many ways. The gap between the rich and poor makes it hard for people from low-income families to access good education, healthcare, and job opportunities. Without this, they can't fully contribute to the economy, which slows down productivity and growth. One big issue is the digital divide. Many rurals and low-income families can't afford internet access. This prevents them from benefiting from the growing digital economy and widen inequality gap even more. At the same time, COVID-19 has caused financial struggle for many businesses and individuals. For example, companies facing economic challenges can't repay their loans, which creates further economic instability, especially for those already struggling. To address this, we need to focus on investing in education and skill development. By improving access to affordable and quality education, we can help lower-income groups gain the skills they need for better jobs in high-value industries like technology, healthcare, and finance. The government is already working on this by redirecting subsidies to support low-income families. This means more funds will go towards helping them access better education and training opportunities. Programs to teach skills in areas like digital technology and healthcare are especially important. They prepare people for the industry for the future like those tied to the 4 industrial revolutions, and help ensure everyone have a chance to succeed. In short, investing in education and skill development is the key to reducing economic inequality in Malaysia. By giving everyone the tools they need to succeed, so we can create fair and stronger economy for all.
So, to conclude the challenges Malaysia faces in developing its human capital in a post-COVID-19 world, Malaysia confronts substantial problems in growing human capital, which will necessitate a diversified strategy. The epidemic has worsened pre-existing problems such as skill gaps in technology sector and over-reliance on the foreign expertise, and skill gaps in healthcare sector, and also an economic inequality. But Malaysia must emphasize policies that promote inclusive education, reskilling and upskilling programs, investing in technology and vocational education and training, TVET, enhance specialized healthcare training and programs, with investing in education and skills development.